Hi guys, today we're going to talk about chapter 14. I'm going to try to explain this chapter in about 30 minutes or so you can watch this video and rewind it. If there's anything that you're unsure about, please come and get me and ask me, email me, talk to me after class. We only have 2 more classes left, which is December the 1st and then December the 8th. We're going to have our final in December the 15th. Alright, let's get started. Please open your PowerPoint so you can follow along with me. I'm going to look at my PowerPoints as well, so we will be in the same page, okay? Bear with me, and I'm going to show you the page as well. So when you say musculoskeletal, we're talking about 2 systems here, which is your muscle, and skeletal, which are your bones. And FYI, the Latin word for bones is osteo. Osteo. So if you hear anything with the osteo, they're talking about bones. Do you remember when we're talking about muscles in the cardiac chapters? Anything with myo. Myos are muscles. Okay? We started our PowerPoints here with the first one. They're just talking about the different terminologies of orthopedic, osteopathic, chiropractors, and physical therapists. All of those definitions will be on page 460. And you will also will learn the abbreviation of medical doctors, which is MDs, and DOs, which is doctorate and osteopathy. Okay? By the way, osteopathy. I just corrected myself. I made a mistake in pronunciation. By the way, what does pathy means? Okay, for those of you who are in my classroom for cardiac, when I say cardiomyopathy, okay, pathy means a disease. Cardio, your heart. Myo means muscle. There is a disease or abnormalities in the muscles of your heart. Okay? And then also on your slides number 4, there is a physical therapist. The abbreviation for physical therapist is PT. The second one that you might remember, if you are in the hospitals, you might hear PT, OT. OT is occupational therapy. Okay? So why do we need to learn about skeletal system? Because there are a lot of disease based on the skeletal muscles. Okay, you can have some congenital disease. You can have fractures. That is considered trauma. You can also have malignancy. Okay, what's the meaning of malignancy? You don't remember? Look it back. Also, what's the meaning of benign? Okay, benign versus malignancy. On your page 462, there are 4 components of the skeletal systems. You can see the bones, one of them, cartilage, tendons, and ligaments. So all of the disease are based on the disease in the bones. Is there any cartilage issue, tendons, and ligament? So ligament, what is the definition of the ligament? That is a band of fibrous tissue. You can look it up in page 463. That connecting the 2 structures. So 2 bones meeting together, connected by a ligament. And then what's the definition of a cartilage? Cartilage is a firm connective tissue. Firm connecting tissue. So the difference between ligaments and cartilage are non-vascular connecting tissues found mostly in the joint. And then ligament is a fibrous. So it can be connecting between 2 muscles. Okay? There are multiple functions of the skeletal systems. You can read it up in your page 462 or on your slide number 5. And this is a quick overview of what's going on. What are the names of the bones? We already read a little bit. Remember in the nervous chapter, we're talking about the head. Quick recap. Frontal bones, parietal bones. Okay, what is this, guys? Your temporal bones here. And then you have your zygomatic bone. For all the ladies who like to do a contour, that's what you get, the zygomatic area. You have your maxilla and your mandible. So if I say TMJ, temporomandibular joints, TMJ. Okay, so now you figure it out. Temporal mandibular joint. So there it is. Okay. All right. The next one is the structures. Okay. The structures of your bone. Before that, let's go for slide number, this one is slide number 7. Just wanted to remind you, go back to chapter 1. What are the suffixes mean? IC, okay, chiropractic, and then this repeated again, okay, osteopathy, musculoskeletal, detoxification, okay. Detoxification means to remove something. Detox, so to remove the toxin in this case. Okay, let's go to slide number 9. This is just an FYI slides when there are many factors affecting the bone growth, and this is one of them, which is the mineralization that also depends on multiple vitamins like vitamin A, C, and D. And the reason why I brought it up, because there are multiple of bone disease that has something to do with this vitamin A, C, and D. Okay. The next slide, which is slide number 10, it's explaining the structures of the bones. If you are in an anatomy class, they will talk about more of these structures. Okay, but I just want you to be familiarized when they say epiphyseal plate. Epi means what? Guys, it can be above, it can be upon. Physis means the growth. If you want to know and read more, it's 465. Okay. And then the other one is diaphysis. That is the shaft of the long bones. And FYI, I don't know if you still remember in your anatomy class, there are bones that are characterized by its shape. One of them is the long bones. Long bones, for example, is your femur bones. Those are the long bones. They have multiple specific areas that differentiated all of them. And one of the area, it's called the shaft of the long bone. It is called diaphysis. And then you have the epi. Epi means the above, so it's closer to your hip area. And then you have the metaphysis. That is the beyond, meta. So if you say, like in research, if you say meta-analytical studies, meta means beyond, like prolong, after, subsequent to. All right. And it just has to, just to brought it up here, that we have the blood supplies and the bone marrows that affecting the formation. Now, if you read in the previous chapter, the blood chapter, if you read about bone marrow in those chapters, now you know and you can learn more about it. Let's go to the page 467. There are some terms that we want you to learn and differentiate. How, okay, I said about bones, osteo. If I say osteocyte, cyte means cell, osteo means cell of the bone. And then if I say osteoblast, blast, it's like precursor. So before osteocyte, okay? Osteoblast. If I say osteoclast, so what is the class means? Okay? What is class means? Class means breakdown, osteoclast. If you forgot about it, look again in, I think I found it here on 465. Osteogenesis. So what's the meaning of osteogenesis? Genesis is process of creating the bone tissue. So osteoblast is the bone forming cell. Osteocyte is the cell itself. Osteoclast is the bone removing cells. And then the osteogenesis is the process of forming new bone. All right. Hope it's clear. And again, if you have any questions, come and get me, ask me during the classroom, or email me. Alright, the next one is slide number 13. This is a very common picture. You have a normal bone and osteoporotic bones. Okay, guys, there's a new term here, osteoporotic. Osteoporosis, okay? Osteoporosis. So it's like bone, brittle, porous. You see that? There are multiple holes there compared to the normal bones. And then the other terms that we need to know here, osteomalacia or rickets and osteogenic sarcoma. Okay, remember at the beginning of this lecture, I was talking about the malignant and benign sarcoma. Okay, sarcoma. So it's tumor, and then that affecting your flesh. Okay, it's also in your book. Okay. And all right. So when you have an osteoporosis, you might ended up with multiple fractures. Okay. In your book, there is a table that explaining the fractures. Okay. You have a linear fractures, and everything it has something to do with how the bone is broken. So if it's only like a line, it can be called linear fracture, okay, parallel with the long axis of the bone. If it looks like a, in children, this is very common, it's called the green stick fracture, okay, so only one side break. And so that depends on how it runs, how the fractures run. The second one is closed or open. So if you have an impact, okay, you have somebody stab you or somebody hit you with a hammer, you have an open wound, and then the bone itself is broken, that is called an open fracture. If you have that just fell on your hands and then there's no skin that is open, it's called the closed fracture. The other thing, it is called displaced and non-displaced. So if you have a broken bone that looks like that, and it's still in the same axis, that is non-displaced, but if it's shift to the front or shift to the back, it's called the displaced. And then the other one that you might wanted to know is compression fractures. Compressions, it's like your vertebra. If you are sitting and then somebody push you from the top like that, and then it's compressed, that it's called the compression fractures. All right, so that's just like a quick thing. Remember, closed, open, linear, displace, non-displace, okay? And then you also have compression fractures. And then when you have osteoporosis, you need to get tested, and there are multiple tests for that. It's in your page. I think it should be somewhere where all the joints movement, close to that, but in your slide number 14, you have BMD, DEXA scan. BMD means bone mineral density. DEXA means dual energy X-ray absorptiometry. Okay, you know what FDA means. Tell me what's the meaning of IU. Okay. All right. Let's go. 15. You have 15. Slide number 15 here. Okay, guys. Bear with me for a second. And 15, you have achondroplasia formation, osteomalacia, sarcoma, and osteopenia. Achondroplasia, what's the meaning of achondroplasia, guys? Achondroplasia. So those little people. And penia. Penia means deficient. Penia. Remember, thrombocytopenia, leukopenia. Now you have osteopenia. Okay. We already talked about the terminology, close, open, complete, incomplete, pathologic versus compression. That is number 17. Oh, by the way, the abbreviation for fractures is FX. FX. So if I wrote in the cases, think about FX is a fracture. Okay, now let's go straight to number 22. These are, or in your page 472. Remember the movement, goes to the movement of your muscles. Flexion, extension. You flex, you extend. Extension is straightening, flexion is bending. The next one is rotation. Rotation. Medial rotation, lateral rotation. Medial, lateral. Medial means close to your midline. Lateral goes towards, what is that? Your side. Okay? The next one, remember, supination and pronation. Prone position, lying down. Supination, open it up. Lying face up. Remember this, circumdiction. Circumdiction. Okay, let me sit. Up. Yep, circumdiction. The other one, number 27. That's your feet. Inversion, inversion. Inversion, that is turning the ankle so the sole will be in the opposite of your, faces opposite of your foot. So inversion, that is exit. So laterally away. Okay, I know you cannot see my feet, but I'm trying to understand here. So what's the adduction? ADD. Abduction. Away with the B. AB, out. AD, close. Extension. Extension. Okay. And then prone, supine. Extension, the opposite is flexion. Extension and flexion. Okay. So now we're talking about the disease of the joints. When you see the joint, okay, and then you see the bone, again, what was the medical term for bones? Osteo. So if you see osteoarthritis, arthritis, okay, itis, inflammation, it's like the joint. So the disease of the bone joint that has an inflammation. Rheumatoid arthritis. Rheumatoid arthritis. There will be a different location between osteoarthritis or rheumatoid arthritis. Osteoarthritis abbreviation is OA. Rheumatoid arthritis abbreviation is RA. Yeah. And then you have another one, bursitis. I'm sure most of you have bursitis before. If you want to know rheumatoid arthritis, rheuma, that is rheumatism. Oit means resemble. It's in your page 475, guys. Okay? Bursitis, back to bursitis. Bursitis, that is inflammation from the bursa. I know, like, you have this little nicking pains there behind your shoulders, guys. Alright? So I already did tell you the abbreviation that is on your slide number 38. OA, osteoarthritis. DJD, that is degenerative joint disease. MCP, metacarpophalangeal. Where's the location, guys? Metacarpophalangeal, it's in your hand. There. And then OA, I did tell you. PIP, proximal interphalangeal. It's also, okay, can be in the fingers and your toes. And then you have THR, okay. What does the THR means, guys? Total hip replacement. And then you have RA. I did tell you about that, RA, which is rheumatoid arthritis. Alright, 31. Synthesis, desis, graphy, plasty, scopy. Scope, you already know what it is. Okay, what? Scope mean examination, to scope. Plasty means to restore the function. So you put a cover, like a plastic, okay? You're trying to restore and preserve the function of, in this case, it's a joint. Graphy meanings you're doing an X-ray. You're trying to take a pictures of it, photograph, and then arthrodesis. Now this one is a new thing. Desis means fixation or stiffening of a joint by surgery. Arthrodesis. That's probably you want to mark it down. And then arthrocentesis. Synthesis means you're moving with a needle. You're trying to move a fluid from a joint. So arthrocentesis. Mark down this number, slide number 31. Okay. Now, the next one is slide number 33. You have 5 regions of the vertebral column. Just to recap, your thoracic, that's the first one. Cervical area, your thoracic. And then you have your lumbar. And then also your sacral, your tailbone area, coccyx, and your sacrum area. The terms that there are 3 things on 35, slide 35. Spine, adjective form of that is spinal. And then you have scoliosis. Scoliosis. Okay, so it looks like a letter S. Your back looks like a little S. And then you have lordosis. Please remember that. Look like an L. Kyphosis looks like a K backward. I can show it to you, or you want to look it up. 4 things: scoliosis, lordosis, kyphosis, and you have this word spine. Okay. All right. Let's move along. We already talked about the head, the bones. Okay, what are the areas like parietal, temporalis, and then also your, what is that called? All right, you tell me. Okay, let's go to slide 40. I know I'm running really fast here, but I just want to get everything is under control because I think I have 7 more minutes, guys. 7 more minutes. Okay. Now, let me tell you, if you have a shoulder issue, I mentioned one, bursitis, and then you have rotator cuff tears, shoulder dislocation. So you know what it is, right? It's not locating at the same time, and subluxation. So, tell me what's the difference between dislocation and subluxation? Subluxation. Okay. If you are subluxation, that means it's just moving out of the socket and then move back in. If it's dislocation, you just move it and you can't move it back in. Okay, so like you have a fracture or like you fell, outstretched hands like that, and then your shoulders, some part of your bone is just like moving forward and then you can't move it back. That is dislocation. Okay. Now let's talk about slide number 43. 43. Learn about what is a tennis elbow, guys. Tennis elbows. That is when you are playing tennis, like that, right? And then the elbow is opening and closing the fingers. That is, the pain occurs when the elbow is, when straightening the elbow and then opening and closing the fingers, just like so. Okay, so like you're playing tennis. That is called tennis elbows. And then forearms and action. Let's see that. The hands. Just want to make sure you remember what I said. Phalanges, carpals, metacarpals. The movement again, oppositions. Now disorders of the hands. So you have rheumatoid arthritis that affects your hands as well, mostly bilateral. And then you also have osteoarthritis. There's a picture there that is osteoarthritis. So that pictures show you what is the process of osteoarthritis. Okay. So if I say there is a sacroiliac joint strain, where's the location? Your sacral and your iliac bone, so it's close to the hip. And then what's the meaning of diastasis? That is, let's see, you have it in your, okay, what is this? Okay, that is 52, slide number 52. You have, if you have a diastasis symphysis pubic, there is a pain over the joint, difficulty walking, you have a trouble climbing stairs and turning over when you're sleeping. I'm sure some of you and me, I probably have it too. When you're trying to, there's some shooting pain over that specific joint. Okay. What's the meaning of necrosis, guys? Okay. That's another homework. Think about it. What's the meaning of necrosis? A vascular necrosis. Okay. Anatomical order. Real quick. 59. The correct answer is put the terms in the correct anatomical order from the head to toe. So, the answer is pubis is the first one. And then you have femur. Okay. And then you have patella, tibia, and fibula. Tibia and fibula can be from anterior to the posterior. And lateral, posterolateral. Okay, 61. Disorders of ankle and foot. These guys are usually being seen by podiatrists, which is your foot doctor. You have a bunions, pot fractures. Pot fracture, that is a fracture pot on the fibula near the ankle. Okay. And then you have gout. You have plantar fasciitis. Okay. Plantar means what? The bottom of your foot, right? Plantar fasciitis. So there is an inflammation in the fascia, which is the covering sheets of your muscles under your foot. That's what usually happens when you are a runner. What occurs with the weak plantar fascia? There is called flat foot. When people have a flat foot, the runners. And the medical term for flat foot is pes planus. P-E-S-P-L-A-N-U-S. Pes planus. Okay. Now, the common names, the medical terms. 62. Calcaneus is your heel bone. Heel bone. Talus is your ankle bone. Metatarsus are the foot bones. That's my answer. Alright, arthrography. 64 means the x-ray of the joint. Using contrast medium. Arthroscopy, scoping. That is, you wanted to examine the interior of a joint. Arthroplasty, we already mentioned this.